How does addiction and mental health disorders affect families? So it's interesting. When you have a family system with a person struggling with substance use or mental disorder, the family focuses exclusively on that person, that they need help. They have to have help. They have to have help. They have to have help. And I agree with that. I immediately look at the situation and think, why aren't they getting it? And the reason they're not getting it isn't because they don't want it, it's because they don't have to get it. Remember, guys, addicts and alcoholics use drugs and alcohol as a cry for help. They want help. They don't like the way they feel. The goal is to get them into another solution that isn't destructive to themselves and their family. But if I were to ask your family who the problem was in the relationship, you would all point at your loved one using substances with a mental disorder, and I would say you're partially right and more wrong than right. And when I mean wrong, I don't mean that literally. I just mean there's more to it. And what it is a family system breaks down when there is a substance user or person with a mental disorder in the family. What ends up happening is one person becomes a primary enabler. All of their attention focuses on the intended patient. What it ends up happening is all the other family members in the family system are affected now, because there's not an equal distribution of attention, love, affirmation to the husband, to the other children, to the grandkids, etc. And what they'll find out later in therapy is that the resentments weren't necessarily with the substance user or the person with a mental disorder, they were with the primary enabler. Because the primary enabler's job is to react to the chaos and the drama of the substance use and the mental disorder. So people get on the phone with us and they think it's like, we got to get him help, just come talk him into treatment. Guys, that's a $1,500 interventionist that'll come do that, or a 12-step guy can come do that for free. Your guy's problem is that the family system has been put into a state of chaos and confusion. And even though you don't see it, it comes out in the way that you communicate. How does it affect family? It destroys it. It rips it apart. The entire curriculum at Family First Intervention recognizes that, and we support you in the aftercare as your family system resets itself and tries to put itself back to normalcy after the intervention's over. It affects the family by tearing you apart. And one last thing I want to say, it's just like when people call our office and say, everybody's on the same page. Never been true one time. There's some aspects of it that's true. So you all want the situation to change. But if I get 5 of you or 10 of you on the phone, you're all going to give me a different opinion or viewpoint of what we should do, how we should do it, or maybe that we shouldn't do anything at all. The decision maker has to make the decision to do the intervention. Then we include the others who are effective, because the way that the addiction and mental health has affected the family is different for each and every person in the family system. You have to focus on the ones at the top and then look at it from downward, meaning the people at the top, the enabler, has affected the other family members, and you're all focused on the substance user and the one with the mental health disorder. Fine, rightfully so, but that isn't the entire problem. It is destroying your family, and we're going to help you put yourselves back together.